alongside the attention that's been paid to long COVID, I think is also emerging appreciation for the impact of COVID-19 on mental health, and that there are potentially mental health consequences of COVID-19, which may or may not fall within that sort of category of illness we call long COVID, but could be kind of a sort of a distinct kind of group of long-term outcomes that we have to really be aware of and capable of responding to. And I say this because I think there are clear data that COVID-19, getting infected with COVID-19 might have long-term mental health consequences for people. But also, even for people that have not been infected by COVID-19, I think the last year of the pandemic has really had a mental health impact like no other. It's been such a disruption to people's lives and routines, their ways of interacting with people, that even if people have not gotten sick with the virus, they've become ill, or worsened in terms of their mental health from the impact of the disruption to their lives. So we're really interested in trying to collect more data on this across a broad population. So in the COVID symptom study app, we did launch a mental health questionnaire last month, which I think is hoping to be able to address some of these questions. What is the impact of the pandemic and lockdown on mental health? What is the impact of having the infection on mental health? And also, some also questions about, what is someone's sort of baseline history of mental health conditions? How did that potentially put them at risk for either getting infected or having long-term sequelae of COVID-19? So is there potentially a link between having pre-existing issues with mental health that could, manifest themselves as longer-term symptoms?